As the opioid crisis continues to sweep across the country and states begin taking legal action against drug makers, DePaul is taking steps to prevent the epidemic from reaching campus and providing resources for students dealing with substance misuse.
Taking sort of national statistics and looking like we're not some special bubble, right? We have students and staff and faculty who would be affected by these issues.
According to the Centers for Disease Control and Prevention, the CDC, there have been nearly 400,000 deaths in the U.S. related to opioid overdoses since the late 1990s. In 2017 alone, about 47,000 Americans died as a result of an overdose. Meanwhile, some 1.7 million people dealt with substance abuse disorders related to opioids, according to the National Institute for Drug Abuse. That same year, 796 people died of opioid-related overdoses in Chicago. That's up 9% from the year before. Recently, state and local municipalities around the country have sued large pharmaceutical companies for their role in this crisis. In September, OxyContin manufacturer Purdue Pharma reached a tentative settlement with 23 states and more than 2,000 municipalities for more than $10 billion. While experts are still searching for ways to curb opioid use, there's a medication that can reverse an overdose if administered properly. It's called naloxone, also known by its brand name Narcan. It can be administered as a nasal spray or injected into muscle. First responders across the country are beginning to carry this life-saving medication, including first responders at DePaul.
DePaul is not immune to this crisis. So just like we have AED machines, these life-saving measures should a crisis or an emergency happen, we felt it was also important for us to have Narcan on campus as well to respond to the opioid epidemic.
Last year, DePaul's Student Government Association, SGA, partnered with a group at the college called Students for Sensible Drug Policy. They worked with university administrators to bring naloxone to DePaul. Current SGA president Giselle Cervantes says some students bought Narcan themselves and took a training course so that they could help others on campus if an overdose were to occur.
And that was really striking to me because it was wonderful to hear that there are students that are like being proactive to care for other students at DePaul, and that made me really happy, but it also kind of made me think that this is something that public safety should know. This is something that folks who maybe work like at the university should know so that it isn't just on the students.
In January, DePaul rolled out the Opioid Overdose Prevention and Response Program and trained all public safety officers on how to administer Narcan. The program includes 32 opioid overdose kits in 29 locations across both campuses. Each kit includes 4 doses of the naloxone nasal spray Narcan. The kits can be found in most automated external defibrillator machines, which help those in cardiac arrest. The white metal boxes can be found across campus, like the one behind me in the DePaul Center. The kits are also in public safety patrol cars and at the front desks of residence halls.
That's wonderful peace of mind that like if I'm in a situation where I'm on campus and someone is experiencing symptoms of an opioid overdose, I can call public safety and they'll be able to deal with the situation.
All this comes with a larger university effort to address substance misuse and addiction. The university has a substance misuse prevention task force that includes weekly alcohol and marijuana workshops and a recovery community.
We're armed with Narcan. We've got it all over campus. We also hope to never have to use it. And so that would involve getting people into recovery or into other harm reduction facilities or getting the help that they need.
Katie Bellamy is the substance misuse prevention specialist at DePaul. Before coming here this year, she worked as a clinical supervisor treating substance use disorders. She heads the program, leading workshops for the DePaul community to learn how to administer Narcan. She calls the medication a miracle.
Let's say that they're unconscious from benzodiazepines and alcohol. Let's say it's some other health condition, but we're not sure, and in good faith we're administering Narcan. It's not going to cause any harm.
However, if a person is experiencing an overdose, they would be immediately put into withdrawal. Narcan is also the same dose for everyone, men, women, children, or pregnant women, and it's easy to administer.
I have this trainer here as an example. So if anybody's used like Flonase, it's really as simple as that. So you take it out of the package. This is what it looks like in the package. You open it up, take it out, 2 fingers, get your thumb here. You don't press it till you're ready. You put it in a nostril, push, and that's the dose.
DePaul isn't the only university bringing Narcan to campus. Harvard University police carry naloxone, and New York Governor Andrew Cuomo wants Narcan in every dorm in the state university system. For Good Day DePaul, I'm Marissa Nelson.